Denver is home to one of the top facial plastic surgeons in the country. Dr. Jeffrey Raval is a double board certified head and neck surgeon who has been named one of the top surgeons by the Consumer Research Council of America. And he just received the Top 10 award from Vitals.com, which is given to the top 1% of all physicians in the country. Dr. Jeffrey Raval is live with us this morning to show us the latest procedures that are changing the face of plastic surgery. He brought Jeannie to help us demonstrate. She did her lips yesterday, but first let's talk about the two sides of your practice.
So we kind of have a complete cosmetic facial plastic practice. Everything from skincare products to laser peels, to surgical procedures. And we go Botox, Dysport, fillers, and then we can do everything from facelifts, rhinoplasties, which are nose jobs as they call it, and then to eyelid surgery. So we offer everything that anyone could be concerned about with the aesthetics of their face.
Yeah, you did Botox on my forehead last time. It looks great. You told me it was going to take a couple days to kind of see the effects of it. I feel so young and youthful, and it felt great while you were doing it. We did it live on TV.
Yeah.
And during a commercial break, and you do it really fast. So we're showing a little bit of what people experience when they come to your office. It's such a great place to go, so relaxing, and you really take care of your patients. Let's get to Jeannie, because I really want to talk about these fuller lips that she has. You did this in phases. We got to tell people as we come back live that you did the bottom lip first, and she's going for more fullness, right?
Yeah, so one of the biggest concerns that people have is, well, what am I going to look like? Am I going to have a lot of bruising? What is it? So we thought what would be really nice would be to do an injection yesterday. We injected her lower lips yesterday, and when I say most people have minimal bruising, you can see that she has minimal bruising. She has a little bit of a bruise on this right side, but aside from that, everything looks like it's still...
That's to be expected,
It's to be expected. It's you know, there's a needle involved and there's a shot, and you can get a bruise with it.
So Jeannie, can I ask you, how was the experience yesterday?
It was great. I didn't feel anything, and I love the results.
I know you look so full on the bottom. Were you expecting such great results in such a short amount of time?
Well, I have such thin lips, and I didn't expect it to be as full as it is, which I love.
Yeah.
And I feel like those little fine lines are gone.
Okay, that is great. So I'm hoping we can get a quick close-up on that bottom lip, just to show that this is, you told me this is a new product. It's Restylane Silk.
So it's a new product called Restylane Silk. And the goal with Restylane Silk is to give someone back the lips they had when they were younger. We're not talking about giving someone big augmented lips that people are always afraid of. Yeah, and she's still a little swollen today, but when it comes down, the swelling comes down, it's going to look very natural. What I like to tell people is we're trying to give you the lips you had when you were 20, okay?
But
we don't want to give... We all lose volume in our face as we get older. The lips are just one part of it. And we'll show you some photos later about adding volume to the rest of the face, because we have some photos of showing that. One of the things I want to talk about is one of the reasons why Jeannie says she really didn't have much pain yesterday is we did numb her. We gave her some numbing shots, like going to the dentist, and we gave her some numbing cream. We actually gave her a little bit of numbing medicine in her upper lip, and we're going to do a demonstration, probably just half of her lip today, to show you how simple this is and how quickly you can get this treatment.
You're so great at injections. Go for it.
Okay. You ready, Jeannie? Okay, bring your chin up just a little. So the first thing we do is we want to establish a new border for her. So we're just going to put the needle into the lip border. And then we literally just kind of inject as we pull back. And you can see here, you can already see.
She's very relaxed as you're doing that.
Yeah, we did, and we did numb her. We did clean her, sterilize her lip with alcohol wipes before the show. But I think you can see already that she's starting to get a little bit more fullness into her lip border.
Oh my goodness, that is unbelievable. That's almost instantaneous.
Yeah.
Look at that.
And that's it. So we're just going to do the half. Just, I just wanted the viewers to see how simple it is. Well, here, let me do a little bit more. One of the things I wanted to do is we're going to add a little bit of fullness to the middle part of the lip, which keeps it looking natural.
Oh my goodness, that looks great. And we want to tell people out there that you're the only clinic offering this right now? The Restylane
We're one of,
Silk?
yeah. As far as the last week, we were the only one, but we're probably, I guess we could safely say we're one of the only ones right now, probably in the Colorado area that's offering this new filler.
Wow. Okay. Yeah, let's get to your before and
after
pictures.
We'll get to some before and afters just to
I want to show some more of those lips. So
So now
tell us about
this is a lip augmentation injection. Again, one of the things again we're trying to do is keep everything looking natural. The best way to do this is to add fullness to the middle third of the lip and then taper off to the sides.
That looks beautiful.
But you can see how we added lips there. This is a unique test or trick that we do with Botox, where you can add a little Botox to the upper lip and it can help reduce the wrinkles. Dysport works just as well. Here's someone, we talked about volume loss as we get older, volume loss in extremely fit people because they just have no body fat. And this is adding volume to the entire face. This gentleman, we had a little bit of filler to his cheekbones, around his eyes, and even what we call the submalar area, the cheek area. You can see here on the profile how, especially around the eyes and the cheek, how it really gives them a less tired, more youthful look. Once we add volume to the cheekbone, the cheek is another area where we tend to lose a lot of volume as we get older.
Absolutely.
A combination case, again, something that we offer uniquely only in a facial or a cosmetic surgical practice, where we can do something like a facelift plus filler plus some laser peels, and we can get a very nice overall natural looking result.
That's great. One more picture here. It's her lips, right?
Well, no, this is a before and after frown. So you can see her frowning. So it's a before and after Botox injection to the frown area, and you can really see how the wrinkles have improved greatly. Believe it or not, she is trying to frown on that second photo.
And she can.
And you can see how the wrinkles have improved.
That's great. Well, thank you so much for coming on. I am fascinated by these fuller lips that Jeannie brought today and that Dr. Raval provided. So here are the details of that offer again. Receive 40 units of Dysport free when you purchase Restylane Silk. That's a $240 value, and you're getting it free. Just call today to schedule your appointment and mention Colorado's Best. Call Dr. Raval and Rocky Mountain Facial Aesthetics right now to get this offer. Here's their number, 303-381-3223, and you can also learn more online at ravalmd.com. And they're conveniently located at 3773 Cherry Creek North Drive. Look your best with discounts on the products and services by Raval Facial Aesthetics and Rocky Mountain Laser Aesthetics. Here's that number again, 303-381-3223. All right, coming up on Colorado's Best, low thyroid function affects more than 30 million women, but you don't have to be a statistic. Meet the local doctor who's giving his patients real solutions with real results. And later, it's one of the most